Okay, so good afternoon, good morning, good evening, wherever we are in the world today. My name is Dr. Macy Levan, and I'm the social media editor for the Transplantation Journal. Today, we're going to be doing a behind the paper of the Global Observatory on Donation and Transplantation. This is the 2024 report that has been peer reviewed and published in the Transplantation Journal. And I am joined today by three exceptional guests. One, Dr. Stefan Tullius, you know him well. He's the editor in chief of the Transplantation Journal, also very active, involved in this project. I have Dr. Beatriz Domínguez-Gil, who is also very involved in this project and comes to us from Spain. And I have Dr. Friederike Martin, who was the first author of this fantastic paper. So for this behind the paper, we really want to talk about what this global data means for healthcare systems, for trust, for ethics, and some policy realities that might come into play for our global transplantation initiatives. So, really, what this is about is making global transplantation data accessible to everyone. What does this kind of show us about our values in national and international healthcare systems, governance, and sustainability? So I'm going to kind of start with a couple of questions to our group. So really, can you tell me about what is the Global Observatory on Donation and Transplantation to start? Who's involved in it and how did it come to be?
So maybe I can start with that. So the Global Observatory with the GODT, let's talk about it as the GODT, was an initiative that was developed under the request of the World Health Assembly. So the World Health Assembly, in which all health authorities of member states of the World Health Organization make decisions, they have been developing different resolutions by which they request member states to do things in the transplantation field and request the Secretariat to do things about it, about transplantation. And many years ago, at the beginning of this century, the World Health Assembly asked the WHO Secretariat to collect data on donation and transplantation activities throughout the world for the sake, as you said very well previously, for the sake of transparency of practices and for international benchmarking. So this was basically the idea. So the WHO relied on the organization IDirect, ONT, the Spanish National Transplant Organization, ONT, as a collaborating center to do the work for the WHO. So ONT and the Ministry of Health of Spain, the Spanish government, is supporting the development and the maintenance of this observatory, which is an international database in which official national focal points from different member states provide every year data that are compiled, collected, and analyzed centrally and made available through a website, through reports, and now through this peer-reviewed publication.
Well, it's fantastic. So Spain and your role running that system was kind of tasked with organizing this project. Is that correct?
Correct. So
Okay.
I think here Dr. Tullius can share his vision about why it was important that the report was not only available at the site. So there is a site where you can access all the data. You can download many data that are available for researchers, for policymakers, for professionals. But in addition, we wanted to be able to provide more sophisticated analysis that could be of higher value for professionals. And here is where the idea of making the report a more sophisticated and detailed report available at the Transplantation Journal. So maybe here, Dr. Tullius can come in with his vision about why it was important that the report came into the Transplantation Journal.
No, thank you, Beatrice. I think, first of all, I think this has been an amazing effort by all the authors on this report. Beatriz, particularly Friederike, who has done an amazing job in analyzing the data. Yes, it is correct that the GODT had a website that was in where one could have access to the actual data, but thus far there has not been a real analysis of this only available global transplant report. I think that is very important to point this out. GODT really is the only donor and transplant report that is covering the global transplant activities. And seeing the progress of donation, seeing particular aspects of donation and transplantation analyzed in that way, that is the unique portion of that report. And we felt that this was necessary, that was important, and it was important to show this to the overall global transplant community. And Transplantation, the journal Transplantation, is the journal that has this global outreach, and therefore we felt it was very important to get this report into the journal.
That is great context. And so can I ask a kind of framing question here? Global data doesn't really tell us who's best, or, we know numbers and volume, right? But this is really kind of helping us tell us what's possible in all these different circumstances. It kind of also is looking at these health systems from a larger perspective and giving everybody the opportunity to kind of see what's going on. Is it really for benchmarking? It's not a competition thing, is it in any way?
Well,
I think
No,
that's
it's about.
no.
Go ahead, Beatriz.
oh, sorry.
Maybe Freddie now, Dr.
No, I
Martin.
think that's a very good point you made. Like, I think it's not about numbers. Of course, you could say like those are the ones who do the most of the transplant or liver transplants, most kidney transplants. But I don't think that's the point we want to make, or that's not the purpose of the report or the data collection, because you can't. I mean, overall, it's aggregated data, and I think one has to consider reading the report and looking at the data, that each country has his own circumstances, his own culture, his own policies, the different resources, and it's not like comparable one to one. And it's more to see an overall trend, how's transplantation doing around the globe, and maybe look at certain countries, see, okay, they are doing particularly well, they have, right, let's say rising donation numbers and whatever. So other countries may be able to look at their policies, may be able to learn from them. I think that's the purpose of the data, and also publishing the data, informing people so that we can learn kind of from each other, rather than just comparing who's the best or who's doing poorly. I think that's not the point of the data.
That's fantastic.
Well, if I may, yeah, if you allow me, I think in fact when we talk about benchmarking, basically that's what we're saying. Obviously, the data are also displayed and presented in a manner that allows you to take a look to countries with a similar reality, a similar background, and evidently can help you to identify practices, policies, or initiatives that can help you change your own reality. So that's what we mean by international benchmarking, to learn from one another. And basically, the data distill information that allows us to see, well, this has been a country making this change, incorporating, well, for example, we talk a lot about DCD, or having a specific practices in living donation, for example. So we can make evident initiatives and quantify the results of such initiatives in a manner that we can inform policy and practice.
Fantastic. That makes a lot of sense. So this is really about, the global partnership, having the World Health Organization partnership kind of with this, and then basically having a big conversation that everybody can have where everybody can learn from each other about what's working here, what's working there, given there's all different health systems, all different payment structures. This is not who's better, who's worse. It's really to be transparent with all of this data. And that's kind of how ethics are embedded into data collection, right? Ethics and transparency for all of this. I do have a question for you, Stefan, as the editor here of the journal where this is published. How does this kind of global lens change how clinicians might think about outcomes in particular countries? Do you think this offers an opportunity for that, or is it beyond?
I think it offers an opportunity for them. I think it will allow them to compare themselves to other countries. But again, the report is there to present data and to present the progress overall in a country specific way. And I think what we want moving forward as well is to have that as annual reports and also to provide additional more detailed analysis on specific aspects. For example, Beatriz has mentioned that already, DCD donation. How is DCD donation working in specific countries? We all expect that DCD donation is or already has and is expected to increase donation rates even more. DCD donation is not available in all countries. And I think it will be important that this is then a focus of a global analysis, and that will help countries that do very well, and that will help countries that are on the way to implement DCD donation.
That's a fantastic example. So with that, I'm going to ask you a little bit about the data. So I think Dr. Martin, Friday, you've been the one that kind of dug into some of that data analysis, right? Do I have that right? So what stood out to you the most about this data from 2024?
So I think overall, it's kind of great to see that after COVID, the numbers are rising again, like the overall transplant numbers. I think that was just great to see. I think we also saw a clear trend that the countries who implemented DCD already are doing quite well with the donations. I think that kind of stood out. But also that we still see major differences between certain countries and areas and regions. So some regions have great numbers and are doing a lot of transplantations, while others, while the data from other regions suggest that the access to transplantation there is still quite limited. So I think those are somehow the major or like particularly major findings or what the data kind of told us.
Yeah, let me jump on that trend for a moment. Either Stefan or Dr. Domínguez-Gil, please jump in here. But when you're seeing differences in countries, right? Like you wrote this report, it's published, people can look at it. But how do we have action, right? What is the action step that you would take as a leader in your respective countries to kind of learn from either good or bad that you've seen in a data trend, for example? Is there an action step for dissemination of this information?
Well, I would say that without the data, it's impossible to frame policy. I mean, these differences help policymakers to understand, for example, whether their community is has eventually a very important limitation in access to transplantation, for example, compared to neighbor countries. Although the data are not presented in this report and it will be made available in due course, we also collect information about patients traveling to other destinations to gain access to transplantation. So we know all countries throughout the world are facing problems to cover the transplantation needs of their patients. It has a lot of implications in terms of mortality, particularly mortality caused by non-communicable diseases. And I say this because NCDs is a major objective in public health today. So if we're able to make policymakers and decision makers aware, first, that transplantation saves lives, decreases mortality, improves quality of life, um, and then can see the difference between neighbor countries or countries that are similar in access to transplantation, they can inform policy and take action. Without the data you may still consider today, if you don't know if you're doing better or worse than your neighbor countries, you may consider that, well, this is a sophisticated therapy. I'm providing this therapy to X number of patients. I know this, but I'm not very sure of how am I doing in responding to the needs of my patients. So I think this data is really a trigger to action by countries. We also display in this paper information about the waiting lists. Maybe Freddie can expand a little bit on that. And it really makes evident how even in the countries that are most active in transplantation, even in the most active, there is a huge disparity between the number of patients on the waiting list and the ability to respond to those needs. So in many senses, the data are displayed in a manner that are essential for action. It may inform you about practices that work, but eventually it makes you position yourself in the way you respond to the needs of your patients.
Perfect. I love that. Do you want to comment on the waitlist issue?
Yeah, I think Beatriz mentioned it or kind of pointed it out already a little bit. So I think what we see are like major disparities between the need for transplantation and the actual access or the access to transplantation. So as Beatriz said, like even in the countries who are doing quite well with their numbers, there's still much more patients on the waiting lists and then patients are transplanted. And this is the case for almost all organs. So I think for kidneys, of course, because it's the most transplanted organ globally, the numbers are particularly high, but also for livers, heart, and the numbers are still on the the patients on the waiting list are still much more than those who actually get a transplant.
Yeah.
And this is an issue around the globe. So it doesn't matter what country, it's everywhere.
Yeah,
and in terms sorry, in terms of accessibility, I just wanted to highlight that it is also very important to point out that not all countries have all transplant programs. So, for example, of the 92 countries that participated with the provision of data, and we can talk about what we don't see in the GeoDT afterwards, because I think it's a very important message today. Countries that do not contribute with data, that's an important message. But of those that contributed with data, kidney transplantation was reported in 90 countries. But for example, pancreas transplantation was reported by 39 countries. Does that mean that every country should have all transplant programs? Likely not, because maybe you don't even have the volume in small countries to have a certain type of very sophisticated program. However, it also provides a very good basis, this information, for international cooperation, which is well established in Europe, for example. In Europe, we have a lot of small countries that might not be able to perform lung transplantation, heart transplantation, pancreas transplantation, the small bowel. It's only performed in 20 countries throughout the world, but you can establish network of countries cooperating with one another in ensuring accessibility of patients to these more sophisticated types of transplants. So when we talk about accessibility, we also talk about, well, there are certain programs that are not very easily available to patients and to many countries. And it also points out other forms of political action, like establishing ways of formal international cooperation agreements.
And then there's
But
the
I
other
don't know if
aspect.
that's important.
There's the other aspect of living versus deceased donors. I think what the report also shows that deceased donation is very differently represented in different countries. And there are some countries that predominantly offer living donation and deceased donors less frequently. I think that is also an important message that the report shows. And I think overall what the report really wants to show is to provide an update to initiate progress through the transparency of global data.
That's really one of my next questions is what does progress mean? And this is progress. It's transparency and global data. You said there's 92 countries that participated in this, but there's still more that we hope would participate in this process in the future. And you mentioned deceased versus living donation pressures. There's a lot of countries that don't even have deceased donation programs. Am I correct in saying that? And so someone actually asked me the other day, do you have a number for how many living donors there are in the world? And I was like, oh, where will I go look for this? Is this the source where we should be sending people if, the media, the lay public, people are writing stories or talking about this? This is the source that we want to kind of send people to for getting those numbers on number of living donors, number of deceased donors.
Well,
I think
absolutely.
yes.
Yeah, well, I wanted to emphasize that in addition, this is an official source, which is important because it is not only supported by the WHO, and it is led by ONT and in collaboration with the WHO. I also would like to mention that the Council of Europe has been supporting this initiative for many years, and both the WHO and the Council of Europe officials are co-authoring this paper as well. So it's important to mention both of them. It's an official data collection, and the data is collected by national focal points that are specifically designated by ministries of health to perform this data collection, and eventually using officially established registries in the corresponding countries. So this is the source. In addition, it is an official source. I think it's important to underline that, but also the fact that there are many countries that still are not participating. Why? Well, for different reasons. Many countries, because they do not have transplantation programs, but we always say that even if you don't have transplantation programs, it's important that you contribute, saying there's no transplantation activity here. Sometimes because there are no mechanisms established to collect this data in the countries in a robust manner. And this is something that we want to change. And by fostering participation in the GODT, this should change also the reality of data collection and transparency within countries. So this is definitely the source because it is official, but there are many countries still missing that should be incorporated and that we expect that they will be incorporated in the near future. And professionals reading this report, if they don't see their country there, they should be able to make some pressure for the ministry to take action and make sure that the mechanisms are established and that the data, that the information about the transplantation activity that they are performing are properly displayed in this official source of data.
Fantastic. So is there anything that surprised you from the data, Freddie, when you were looking at it? Was there any big surprises that came?
I think by now I'm so used to the data that I'm thinking what surprised me. I think I was after all, pretty impressed by, first of all, the sheer number of transplants we are doing every year, and actually by how DCD is influencing the donation numbers. Because I think I was kind of impressed how when you look at the trends comparing the the data to the last years or the last century, you can clearly see that DCD is changing a lot in the countries who implemented it. I think that was, as I said before, like kind of the most surprising thing to me.
Okay. And so that reflects not just donation and transplantation, but right, DCD is about hospitals and systems and how people staff, you know, intensive care units and things like that, right? So it really kind of might be reflective of advancements in whole healthcare systems and not just in transplantation to make DCD possible. But I have another question for you. Anyone can answer. What pressures do you think healthcare systems and transplant systems have been facing that you might have seen reflected in some of this data?
I think this is something we talked about before. It's the difference between patients who are waitlisted and the patients who actually get a transplant. I think this is an issue that all transplant programs and all around the globe are facing, that they simply don't have enough organs to treat all their patients that are waiting for one, I think.
So infrastructure, right? I mean, it's
yeah, and also donations, simply donations. Like what the reasons for the lack of donations can be manifold, and it's but I think we clearly see a lack of organs that we can transplant.
okay.
Uh,
Go ahead.
No, I wanted to highlight that evidently when we see the differences in disease donation rates or living donation rates, it basically tells us that if we were able to emulate what certain countries or regions are doing in order to achieve certain levels of disease donation and living donation, we would really be able to solve the clinical condition of many patients. But I wanted to add also something that is concluded from the data, which is the organ utilization. We have looked into the paper to the number of deceased organ donors from whom at least one organ is recovered for transplantation, who do not transition to the organs being actually transplanted. This has to do a lot with DCD on one hand, because donor utilization and organ utilization is lower in DCD because of the impact of ischemia on the organs and the viability of the organs. Also, advanced donor age is a factor, and it tells us a lot about our future. Because of course we have the possibility of increasing disease donation, living donation, and this is something we need to work at. But at the same time, we need to look for alternative solutions to make better use of organs available for transplantation. Donors are getting older, as our communities in many countries. For example, this is the case in Spain or in Europe. Donors are usually persons of advanced age, and the data tell us that we really need to look for solutions to make good use or utilization of organs that are very challenging in order to get appropriate post-transplant outcomes. So the information is really very rich and useful for decisions, as we were saying at the very beginning.
Yeah, it's for advancing policy decisions, resource allocation decisions. But like the most important decision that a country could make is to participate in this if they are not currently participating, because there's a wealth of information that we gain as a global society, a transplant society, right, from having full participation. So what would you recommend for the folks who have not yet participated? What is the next step for them to get involved?
Well, I think this is a decision of the countries. As I said, it's a decision of the Ministries of Health. But by presenting this report in the journal, which is mainly used by professionals and eventually the lay public may reach to it, but it's something used for professionals. I think it would be important, a bottom-to-up approach by which professionals themselves exert some pressure to make sure that the Ministries of Health get involved in this exercise. So to me, that would be an important outcome also of the publication of this paper. But I'm wondering what Dr. Martin and Dr. Tullius think about it.
I think there are two aspects. There is one, obviously, to speak to the professionals, but the hope is also that this report will get visibility beyond that. And I think visibility in the lay population, in the patient population, and that patients themselves will get this information and then use this information to get back to their own government and health ministry and ask for advancements in organ donation and for participation in this registry.
Yeah, so if I'm reading this correctly, there were a record 173,727 solid organ transplants performed worldwide. And that's based only on data from 92 countries. So maybe that number is higher, but we can't report that because we don't have all of that data. And so that's a lot of transplants. That's a lot of patients. That's a lot of people that are getting a second chance at life because of generosity and organ donation. But really, transplantation succeeds because medicine and policy and public trust and all of these things kind of move together. And this is a hallmark example of how transparency can guide outcomes as well as advancements in access. And so I think if there's professionals listening or patients listening, and you're not one of those 92 countries when you go and look at this paper, you should feel very empowered to try to advocate for better data collection and better transparency so that you're included in these conversations in the future. I think anyone here would be willing to support, questions or comments to ministries of health. If you don't know how to do that, I think there's a resource from the Transplantation Society that would be willing to kind of support that endeavor. And I'm sure that the Transplantation Journal would be really happy to support those types of conversations. I do want to dive in a little bit more on this living donation, deceased donation piece. We're seeing at least in the United States, and Stefan can kind of probably back me up on this, but we're kind of in this modernization phase where the transplant system has been receiving a lot of more government investment. And a lot of changes about how we modernize our system have been driven by patients themselves saying they want better, they want us to do more. But when it comes to living donation, we have still been honestly really stagnant. I think the numbers they're not really going anywhere. They're staying kind of the same. Have you seen any countries in your data that you've looked at that are advancing living donation rates?
Well, I would say Freddie can elaborate it further, but I think we see different trends. So it is true that live donation have been stagnant in some countries with very good rates, but on occasion this has occurred in coincidence with an increase in deceased donation. This has been the case in the United States. This has been the case in Spain and other European countries. And it's important to say that the WHO has been very clear that we should be maximizing deceased donation first. The priority in live donation is other, which is ensuring the protection of the live donor. So having high live donor figures is good as long as we can ensure the basics, which is the comprehensive and overall protection of the live donor. So we have seen these trends in some countries. We have also seen some countries with no deceased donor program, which have developed extraordinary rates of live donation. This is the case, for example, of India, Turkey, Mongolia are countries in which live donation is extraordinarily developed. And however, deceased donation is really very low. And this should worry us because Of course, live donation is easier for a country. The infrastructure required for this donation is much more complex. You rely on ICU facilities, a system for organ allocation, coordination activities, many logistical issues. So it is much more complex. But you are somehow deciding to play the burden of donation on the live individual. And getting this balance right is something that is we need to be very careful when looking at it. But I would say, and Freddie can provide maybe more details, that there are different situations and trends. There are countries with a lot of deceased donors and a lot of live donors. Okay, but always ensuring the protection of the live donors. There are countries which are only relying on live donors. Sometimes it's the only way to start because they cannot start with deceased donation. Still, they need to protect their live community from any form of exploitation, and of course, from the healthcare point of view. And there are countries which are starting deceased donation and where live donation is still with a lot of prominence. But the right balance, well, requires a huge amount of debate, I would say, because this donation needs to be maximized. But how much should live donation be developed? Well, I think it depends, and evidently it relies on the community and patients and their families having accurate information about the risks, the values, the alternatives, and then having a well-informed process and a huge care for the patient, of course, and for the donor. So those are my thoughts about it, but maybe Freddie can emphasize something about differences between countries in live donation that draw your attention. To me, those were the three countries where I was really very astonished about the numbers.
Yeah, I mean, yeah, I think that's you already said most of what I would have said. I think one thing one has to consider as well is that the organizational part of disease donation and like the resources you need for that, that's the one issue. But I think another issue may also be the cultural background of those countries and how much people are willing to donate after death. And I think that is also a kind of something that keeps people or keeps countries from organizing disease donation programs. That's the only thing I would maybe add.
I think there are the obvious limitations from living donation. We talked about this earlier, that not all organ types of transplants are developed in all countries, and that certainly is also linked to the frequency and the advancement of deceased donation as a prerequisite for specific organ transplants.
I appreciate all of this. I donated a kidney 17 years ago, before I even worked in our field. And so I do believe in living donation, but I still have a lot of problems with how we manage donors afterwards, how we follow them, how we take care of them. And so I'm very sensitive and very much in line with everything, Beatrice, that you said about ensuring that donors have everything that they need. And I think designing transplant systems with both in mind is really important, with the infrastructure challenges of deceased donation clearly being an issue. But really, in the context of deceased donation, what can we do about that? Well, DCD is increasing. And so I think it's a multifaceted approach to increase access for everyone. But living donor protections are really important. And I would be remiss if I didn't say that. I think it's important that while you're hearing about xenotransplantation, you're seeing it in the news, you're hearing about new trials that are starting, it is very, very early and very experimental. And while it may be available in the future, it is very premature to include it in a conversation around global donation and transplantation. Right now, we are still fully reliant upon donors, whether they are in deceased donation systems or in living donation systems. I think this holistic conversation around all types of donation and what countries can do to be transparent about it, I think is just super important, and really is the way to advance medicine forward with all of the different areas that are donation are possible, whether it's organs from non-human sources, whether it's organs from humans, living or deceased. But really, I think the most important lesson that I've learned from you all is that data transparency and access to that data is really what we need to move things forward.
I wanted to highlight that when we talk about differences in disease donation, I'm a little bit worried about saying that the population is not prone to donate, because we know that in reality, if you take organizational measures, you can change that. And of course, you need a system that is transparent. You need some baseline elements like appropriate healthcare, of course, and access to healthcare. But if you organize the system well, you can make it work. It can function, and of course the system needs to be designed taking into account the culture of the population, your local reality. But even in countries where apparently there might be some reluctancy to donate, things can happen and things can change. Well, I think it's important because sometimes, when you see the data, you may find comfortable in finding reasons for the results in your system, and there is always a way of doing things and improve access to transplantation. And another thing that I think we are missing here is that this data also acknowledge the value of society through donation. I mean, transplantation cannot occur without donation. It cannot occur without it. For the time being and for many years ahead, the transplants come from a unique source, which is the human being. That unique nature makes us accountable. And that's why the WHO has told us on many occasions that we need to be transparent, because we need to display what we are doing to the society that contributes with organs. So it's benchmarking and it's transparency, but it's transparency not only because we need to improve, but because we are accountable in front of the society. We are using a unique source, which is an organ donated by the community after death or during lifetime. And that's an important aspect of the GODT that I think has to be underlined.
Entirely agree. I think the message that we want to move forward with annual reports and continue to have this conversation and provide the transparency and information to the global community and specifically to the countries that participate.
So with that, I really appreciate your work and your time and your effort on this paper. I'm hopeful that these conversations will be elevated in countries that aren't participating, in countries that are participating, and that for the next report that is published in Transplantation, hopefully, what will that be? 2026 data, maybe 2025 data. We're always a little bit behind on data. That's just the way things work with all annual reports. But I'm really anxious and excited to see what becomes from this project. And importantly, your leadership is astounding and remarkable. And thank you for your global leadership in transplantation, all three of you.
Thank you.
Thank you.